Hi, my name is Miran Naljayan, and I'm the Group Medical Director for Team Galaxy. Today, I wanted to share with each of you the why I am a firm believer in putting my patients on home modalities. During my fellowship, I didn't have the opportunity to take care of many patients on home therapies. The few peritoneal dialysis patients that I encountered were either in the hospital or extremely sick. As an attending physician a few years out of my training, I was asked to be the medical director of our home peritoneal dialysis program. It was in this role I had the opportunity to work with these patients and realize this is why I fell in love with PD. These patients were engaged in their own care. In my line of practice, I'm often asked what prevents patients with end-stage renal disease from being on peritoneal dialysis. There are very few absolute contraindications to peritoneal dialysis. In my line of practice, I'm often asked what prevents patients with end-stage renal disease from doing peritoneal dialysis. There are very few absolute contraindications to peritoneal dialysis. Let's address two of the most common misperceptions about PD. Let's first address age as a barrier. Elderly patients do relatively similarly both on hemodialysis and peritoneal dialysis. Studies have shown that these patients do well on APD, CAPD, and urgent start PD. Some studies may show that APD is slightly better for elderly patients, but I think overall the data shows that age is not a predictor of technique failure for peritoneal dialysis. Another great example of a common misperception is that diabetics will fail to thrive on PD. Although some studies have shown that hemodialysis may be slightly better than peritoneal dialysis for diabetics, this is largely secondary to existing cardiovascular disease or poor glycemic control. More studies in this area are needed, but diabetic patients can do well on PD. If the nephrologist partners with the primary care doctor or the endocrinologist, we can all work together to improve glycemic control in our diabetic patients on PD. Patients on peritoneal dialysis have an improved quality of life and increased satisfaction when compared to patients on HD. PD patients have higher employment rates and decreased hospitalization rates, creating an enhanced feeling of control over their end-stage renal disease. This level of satisfaction and the individualized attention patients receive from their dialysis care team allow the patients to feel more in control of their disease and are more adherent to their prescribed treatments. Here are just a few quotes from our DaVita home patients. The advantages of PD are that it allows me to be me, to do the things that I like to do, and to go places without any restrictions. Another patient shared, home dialysis gives me the opportunity to live like I lived before end-stage renal disease. And lastly, we hear from our patient that it allows me to have the freedom I need to live a happy and healthy lifestyle. Today, I'd like to conclude this conversation with a request from me to you, a fellow nephrologist caring for our patients. Please consider home for all of our patients so that patients may choose the modality that works best for them. I believe that empowering our patients to participate in their care is truly the meaning of the physician-patient relationship. At the end of this video, you'll find live links that support the information that we discussed today. Please take the time to look over these abstracts, and if you have any questions regarding the content, please reach out to me or to your local home divisional lead.